I'm Wolf from Healing Wolf Coaching. Let's take a deep physiological sigh, it's called, together. So we're going to breathe in really deep through our nose, filling our lungs. Once we're full, we sip a little more, and then we sigh it out. I've become aware of a new article in The Guardian, and I'd like to read it to you because it's part of the thinking and the research that guides my work with clients. And I feel like it's really helpful to look at articles like this as they continue to enter the consciousness of a world full of anxiety and chronic pain and other conditions that are called mind-body conditions. So this article is called The Mind-Body Revolution: How the Division Between Mental and Physical Illness Fails Us All. New research shows that Western medicine's traditional split between brain and body is, in fact, far from clear-cut and could provide a breakthrough for many complex conditions. And this is by Ada Edemariam. Ada Edemariam is the author. Some years ago, Camilla Nord suffered such persistent pain at the site of an old injury that doctors thought she would need major surgery, a joint replacement in her foot. To delay this for a few months, they injected the foot with steroids. Steroids wear off, but nearly a decade later, the pain was still much reduced. To Nord, whose day job is running the mental health neuroscience lab at the University of Cambridge, this was fascinating. Not all of her pain, it seemed, came from her foot. As Nord knew, chronic pain can cause physiological changes in the brain, a process that is now measurable in the lab. It seemed to her that her brain, as she puts it in her recent book, The Balanced Brain, had become used to pain, monitored pain, and had begun to enhance the sensation of pain on my body. Removing the original source of the pain for a few months had altered this process of neuroplasticity enough to make a lasting difference to the amount of pain she experienced, even after the trigger in her foot returned. A conceptual division between mind and body has underpinned Western culture and medicine for centuries. Illnesses are quote-unquote physical, or they're mental, or quote-unquote mental. But Nord writes, there's no separate category of illness, one that is confined to the mind and does not involve biological changes. This category does not exist. Not only that, she says, but the reverse also applies. There's no purely quote-unquote physical ailment in which your brain does not play a role. Let me read that again. That is very interesting. There is no purely physical ailment in which your brain does not play a role. Recent research makes it increasingly possible to demonstrate this. It also has profound implications for the way an illness should be approached. And now there's big quotes in the article. It is a huge untapped source of possible improvement for people who are ill. And by ignoring it, we are making people more sick than they need to be. Nord has been amused in the months since her book was published by how these assertions have been received, including many variations on, well, duh. People say, well, obviously the body is involved in mental health. What do you mean? You guys are just now discovering this? But it is one thing to understand that food poisoning might come along with misery, for instance, or anxiety with higher heart rate and perspiration, and quite another to accept the science that shows, as she puts it, that everything is physical and psychological. So the research is showing us that everything is physical and psychological. So fascinating. So fascinating. Just trying to get this light right. The sun is coming. So onward with the article. As Monty Lyman argues in his eye-opening tour of recent advances in immunology, the immune mind, it is nothing less than a revolution. You hear that, folks? Nothing less than a revolution that the brain, the unconscious mind, is running the show and woven into every single illness that you might have. This revolution could be transformative for the millions of people for whom, as Lyman puts it, misguided dualistic approaches are causing preventable and reliable harm. So, misguided dualistic approaches. What's a dualistic approach? Looking at things either just psychologically or just physically. So, onward. Currently, quote-unquote physical and quote-unquote mental medical services often have different budgets and administrations. They may occupy different buildings and may not share notes. The medical system often consists of discrete transactions, short visits to GPs, specialists and subspecialists, and the division of illness into specific containable issues, resulting in a pill, an operation, or a course of treatment. It's a top-down arrangement that tends to treat a passive patient as a set of individual parts that require attention. Furthermore, the physical is frequently prioritized over the mental. In terms of budgets and attention, it can be more difficult, for example, to access NHS funds for someone with severe dementia whose body is still healthy than for someone experiencing the opposite. People with major mental health disorders, such as schizophrenia, bipolar disorder, major depression, often die years earlier, up to a decade or even two earlier than those who do not. People often think, well, that's because they're committing suicide, says Mark Edwards, a professor of neurology at King's College London. In fact, they're dying of cancer, heart disease complications, and diabetes and respiratory problems. In part because they're not able to access adequate physical care, they may also be unable to comply. Even if they do not access treatment, they are often treated differently enough, in cancer services for instance, to have measurably worse outcomes. And then there are further millions whose troubles fall between categories. Nord uses the example of functional neurological disorder, FND, the most common medical condition you've never heard of. Patients with FND may have symptoms ranging from seizures, paralysis or brain fog to irritable bowel syndrome or urinary issues, from complex and shifting patterns of pain to tinnitus and movement and sensory disorders. And they account for up to a third, sometimes more, of those attending outpatient neurology clinics. Wow. FND is the second most common reason to see a neurologist. And something has happened on my pad where I have lost the article. Now it's back. Okay, here we go. FND is the second most common reason to see a neurologist after headache. The symptoms affect people's functioning, hence the name, but they are, crucially, symptoms for which no corresponding structural damage can be found. The resulting levels of disability, adverse effects on quality of life, and costs to the healthcare system, notes Nord, are comparable with those seen in conditions such as epilepsy or multiple sclerosis. Tiago Teodoro, a consultant neurologist who recently organized a symposium on functional disorders at St. George's Hospital in London, says, disabling FND is as frequent as Parkinson's. People with FND may be further disabled because they are systematically not believed. Can you believe that? They're not believed. People say pejorative things, says Nord. They say it's all in your mind, and that's a really sad example of how this kind of societal model can really let patients down. The interference The inference that FND is somehow faked or malingering has been shown to be untrue. Nord, whose ability to make research come alive, is matched by a kind of thrilling intensity. Also tells me about a lovely neuroimaging paper that shows that people faking symptoms look totally different in the brain scans than those with functional symptoms. So they can scan the brain of somebody who's faking and know that they're faking. I guess it's kind of like a lie detector test. Faking or malingering, says Simon Wesley, a consultant psychiatrist who specializes in the overlap between mental and physical health, is unbelievably rare. So people who fake sensations, it's unbelievably rare. I mean, who would really want to do that? But the specter of it can haunt patient-doctor interactions, and it's a great pity, because it really gets in the way of actually getting better or helping the people who do, the majority who have these sensations. Edwards, who has spent 15 years researching, treating, and advocating for people with FND, places the problem at the nexus of quote-unquote body and mind. It's a system of consciousness effectively. Consciousness is not a passive thing. It allows introspection and thinking and then directs the body to do something. One of the things that really sets human beings apart from other animals is how amazingly developed this system is. In FND, that system goes wrong. People are out of contact with their body. All of the basic wiring is okay, but they can't get their body to do what they want it to. They can't get it to move, or they're having episodes where it's moving on its own, like a seizure, or they're not getting normal feedback from their bodies, or they feel numb, or they feel weird sensations. And that can extend to other symptoms that people might experience. For example, pain or problems with thinking or memory. It is striking, Edwards adds, how often there is a specific trigger, something like having an accident, an operation, a bad flu, a migraine, a drug reaction, often something happening to the body. Acute stress can do the same, but episodes can also be quite mild, and that seems, in some people, to be capable of causing the system to malfunction, sometimes quite significantly. Now, big red quotes in the article. Your brain can unconsciously predict physical symptoms. Sometimes these predictions are so strong that they generate the symptoms they anticipate. Again, your brain can unconsciously predict physical symptoms. Sometimes these predictions are so strong that they generate the symptoms they anticipate. So the brain is generating the symptoms based on the possibility of symptoms happening. I don't call them symptoms, I call them sensations, because symptoms is a word used for disease, and sensations is what my clients are dealing with. Just sensations, not a disease process. Okay, back to the article. Functional issues, he argues, are often part of illnesses such as fibromyalgia, some kinds of chronic pain, and multiple chemical sensitivity, but they are also implicated in supposedly straightforward physical illnesses such as heart disease or respiratory ailments. Mapping the measurable state of the muscle, that is the heart, for instance, onto the symptoms the patient is experiencing often shows a poor correlation. This gap, Edwards says, is where the rest of the person is. Their system of consciousness plus their emotional and mental health, psychosocial factors, which are environment, support, and so on, and many other things. It is a huge untapped source of possible improvement in symptoms for people who are ill, and by ignoring it in research and clinical practice, we are directly making people more sick than they need to be. Nord also highlights the danger to scientific research. A separation of mind and body carries really profound risks, not only with the way we think about what a disorder is, but also how we might go about designing new treatments, or, in fact, whether we can comprehend how the treatments we currently use actually work. One way in which this is beginning to change is through an understanding of the brain as a place of predictive processing. In other words, it has a general picture or story of what it expects to see, which is then adjusted according to the sensory information received from both outside and inside the body. A process, again, measurable in terms of neurons firing, of connections made or paired away. It is important to remember, however, that, as Lyman puts it, your brain is less focused on reality than it is on meaning. Did you hear that? Your brain is less focused on reality than it is on meaning or interpretation. Many illnesses in this model arise from maladaptive or even over-efficient processing. So, for instance, an injury that the brain has had to respond to in the past makes it more sensitive to a repeat of that injury in the future. This, writes Nord, can cause your brain to unconsciously predict physical symptoms and rush to defend against them. That's what I call protective sensations. Sometimes these predictions might be so strong that they generate symptoms they anticipate. An extraordinary 1970 experiment found that rats that had been given sugar water laced with toxins fell ill even after the toxins were removed. They had become so good at connecting sugar water to illness that some even died. Wow. We are not rats, of course, but the principle is the same. We can become conditioned to expect negative outcomes, and those expectations can make us ill. Wesley reminds me about Pavlov's dogs. You have the unconditioned stimulus. Food makes them salivate automatically, but if you ring a bell at the same time, it doesn't take long before they salivate just with the bell and not the food. That's the conditioned stimulus. Something similar can happen in humans, he argues, and underlies many disorders such as agoraphobia, social phobia, specific phobias to spiders or dogs, or the phenomenon of electromagnetic hypersensitivity. Perhaps someone is taken sick or faints and by coincidence is in a crowded supermarket, but then the same thing happens every time they go back to the supermarket. It's a conditioned response. The symptoms they develop are extremely real, highly physiological, but now have a different explanation. The surge of adrenaline caused by fear. Such conditioned responses can be further amplified by prior beliefs. For example, about risk, a process called nocebo effect. The nocebo effect. If one definition of a placebo might be the powerful therapeutic use of pure expectation, a nocebo is its evil twin. And prediction is, of course, the model we use to understand the functioning of the immune system. Identification of a threat, followed by the dispatch of cells specifically adapted to neutralize that threat, i.e. inflammation. We usually assume such threats to be physical as opposed to mental, bacteria or a virus. But it is increasingly clear, says Lyman, that the immune system does not differentiate. The threat could just as easily be emotional distress, environmental challenges, childhood trauma, or even being sedentary. The resulting inflammation does not differentiate either. Wow. So inflammation can come from a response to a memory, emotional distress based on some perception. Not long ago, Lyman submitted two experiments in which he was injected with bacterial toxins. In the first, within 24 hours, his mood had dropped. He felt fatigued, did not want to socialize, and could not concentrate or feel pleasure. In the second, such feelings were joined by a marked turning inward, which he describes as a mindfulness body scan from hell, focusing on what I thought was going wrong with my body and health. I paid far more attention to the state of my body, particularly negative, uncomfortable states, than I would usually. We recognize this as basic illness behavior, familiar from, for example, the common cold. In short term, it's useful. The body forces us to stay home, heal, and not go out spreading germs. We may not think, however, about how closely all these symptoms overlap with the symptoms of depression. So closely, in fact, that you could say that the injection had effectively caused a 24-hour depression. Another big red quote from the article: inflammation nudges us towards being more sensitive to negative information. For some, this can push them into a downward spiral. Inflammation nudges us towards being more sensitive to negative information. Neil Harrison, the Cardiff immunopsychiatrist who ran the second experiment, told Lyman after he had recovered, "For some, this can push them into a downward spiral. Why do some fall and not others? It is crucial to note," Lyman says, "that it isn't someone's fault for falling. It is possible," Lyman continues, "that inflammation itself could interfere with the brain's updating of predictions about inflammation. The brain, in effect, gets stuck fighting an infection that is no longer there." Just a side note, I see this in clients who've come through an illness, and whether it's Lyme disease or COVID or even vaccines, the unconscious mind continues to fight against something that's no longer present, just a memory. And the sensations are very real. There are two significant points here in terms of what we can do about it. The first is that if inflammation can cause what we recognize as depression, alongside many other drivers such as stress or trauma or genetic factors, there is a significant number of people for whom the current standard treatments, SSRIs, talk therapy, do not make sense. The second arises from the idea of being stuck in a pattern of reaction to pain, mental threat, trauma, or stress. And given the way the brain works, being stuck and reacting over and over in the same way only exacerbates the problem. The brain gets better and better at producing that reaction. But stuckness also gives a clue to possible treatments. If the specific way that your brain changes depends on what you are expecting to happen, if the specific way that your brain changes depends on what you are expecting to happen, Nord writes, it follows that anything that dislodges that expectation, even a little, can make space for other more positive expectations to creep in. And that, my friends, is my work. It's what I do. I create new states in unconscious mind. Okay, back to the article. For about 50% of people, for instance, far fewer than is generally assumed, SSRIs can work in this way. Others might respond to transcranial magnetic stimulation, which can be effective in multiple conditions. Talk therapy also works like this, and in a wider range of situations than one might think. Irritable bowel syndrome, for example, which causes indisputably physical effects such as stomach cramps, bloating, diarrhea, and constipation, has been shown in some studies to improve with CBT. Another new frontier is research into interoception, or the mechanisms by which we all track our internal information. As humans, we put great store in this kind of self-knowledge. Go with your gut, I feel what I feel. In these cliches, our interior worlds are a source of undeniable truth. But it is now possible to measure some surprising gaps between what we think is happening within us, and therefore the information to which our brains react, and what is actually going on. And, badly put, we are often not very good at it. People with anxiety and depression are especially challenged in this regard, as Lyman discovered. Feeling depressed makes us focus inward. This often results in an overreading of what we find there. Depression, says Sarah Garfunkel, a cognitive neuroscientist at UCL, is also associated with a reduction of interoceptive accuracy. Again, a drop that can actually be measured in the lab. So it's overreading in the presence of poor precision. Mind's making mistakes. Unconscious mind's making mistakes. Rather than being discouraging, this is good information to work with, argues Garfinkel, who with Chatrin Successilp, Hugo Critchley, and others had just completed clinical trials in which, over a 6-week period, they trained individuals suffering from anxiety to get better at listening to their own heart rates. In a third of those individuals, anxiety not only dropped markedly, but stayed lower for a full year, as a result about which Garfunkel sounds giddily excited. With drugs, you're then dependent on the drug, and talking therapies or CBT can be hard to implement, as well as taking a long time and being costly. But if these results, which are awaiting peer review peer review, stand up. This is a behavioral technique you can take forward for the rest of your life. On a side note, rather than listening to your heartbeat, you can also listen to your breath. You can focus on your breath. That's something that I believe can achieve the same results. What all of these possibilities have in common is that they harness the whole human and a belief in our ability, and especially in the ability of our brains, to change. The brain is wiring and rewiring itself all the time. Nord reminds me. This is a constant of your life. There's an optimism also in the breadth of treatments that exist, and that while there's no magic bullet, just because something hasn't worked for someone else, or just because a treatment hasn't worked for you before, the nuances of how a treatment interacts with your brain as an individual at that moment means it may well work for you at a different time, or it may work in combination with something else. I tell clients this all the time. Sometimes journaling might be helpful, and sometimes meditation is way better. Sometimes exercise is what you need that day. Sometimes it's having a conversation with an inspiring friend. Sometimes it's walking in the woods and breathing the scent of the pine trees. Okay, back to the article. This all requires a fundamental willingness from everyone, including the patient, to avoid what Lyman calls the two fallacies. The first of the two fallacies of mind, the first is of mind over matter, believing that illness can instantly be cured by a positive outlook. That's a fallacy. The second is a reductionist matter over mind approach. All feelings and symptoms must be an accurate reflection of what's going on in the body. Nope. So those are the fallacies. As Nord puts it, the quote-unquote belief that physical symptoms only come from the body becomes a barrier for you to be treated effectively and to recover. Let me read that again. The belief that physical symptoms only come from the body becomes a barrier for you to be treated effectively and recover. But holistic treatment is not easy to find unless you're listening to Healing Wolf's YouTube channel, because you can find it with me. But holistic treatment is not easy to find, not in the medical system. Teodoro's FND Symposium gathered professionals from across the medical spectrum: neurology, urology, gastroenterology, psychiatry, psychology, physiotherapy. As far as he knows, no such symptom focused on treatment has happened before. No such symposium focused on treatment has happened before, which is a pity, he says, because FND is a treatable condition. All argue that there is a current and urgent need to break down centuries worth of institutional and cultural barriers and use all available methods, cognitive, emotional, social, and physical. Somehow, says Edwards, in the biomedical revolution, which has been fantastically effective and beneficial in so many ways, this bit has got lost and sidelined into something which feels less real, unimportant, and fundamentally stigmatized as a person's fault and sole responsibility. This is what people need to know. There's such a massive prize here. If only we could have an honest adult conversation about the full range of things that drive illness, and then take appropriate action to make it better. That's the end of the article, folks. And The Balanced Brain by Camilla Nord and Monty Lyman's The Immune Mind are both published by Penguin. So check those books out. It's been my joy to read this article with you today. Amazing. I knew all this stuff already, but it's great to see it coming out in such a huge way. And there were some nuances in here, the scientific nuances and some of the research that make me feel even more excited about what's to come in terms of the big general population. If you want me to help you go into unconscious mind and make these shifts so unconscious mind can begin processing information as a whole, holistically, to help you heal and recover, then visit my website at healingwolfcoaching.com. And if you made it all the way to the end of this article that I've read to you today, then thanks for being here. Please subscribe to my channel and I'll keep bringing you the latest.